Hello. Hi, my name is Michael Jones, and I am the founder of the Pacific Rim Headache Center here in Anacortes, Washington. And I'm doing a series of informal chats I guess you would say lectures, but I wish you could be here in a room with me and we could communicate two ways about this. But this is a series that I've titled Why Some Headache Sufferers Don't Get Better. And I've come up with 10 reasons why headache sufferers don't get better. I've covered 2 on my prior lecture. This is part 2. And I do encourage you to go back to that lecture if this is the first exposure you've had to this series. Because in that lecture I also give a little bit of a background of who I am and why I'm doing this. Now again, I will just emphasize one point, and I'm not here to sell anything. I'm not trying to sell you books or trying to sell you tapes or special pills or treatments, or actually I'm not even trying to recruit you to come here because we have plenty of headache patients. But for 31 years now I've worked in headache disorders, and I've had the opportunity to be around some really bright people who work in headaches. And I have a real passion for trying to help people get better. And the good news is most people can get much, much better. Of the 10 reasons why headache sufferers don't get better, only one of those they have no control over, and that's what I talked about last time, of what I call bad disease. So the first one was bad disease. Number 2 was medication overuse headache. And tonight I'm going to try to touch on 3 somewhat complicated, but I'm going to try to do it quickly, 4 more reasons that people don't get better. So reason number 3 would be the issue of impatience. And I see a lot of patients who come to headache clinics, and there was a study a few years ago that showed almost 50% of patients who come to headache clinics don't ever go back. And the number one reason they give for not going back is they didn't like what they heard. They came to hear that they had one specific problem causing their headaches, usually something very simple. A vitamin deficiency would be a wonderful cause because all you have to do is take more vitamins and it goes away. But they don't hear that message. Now our message is somewhat complicated, but the issue is it's the truth. It's how we have found nature, how it's been observed through research. So I did do a lecture on the causes of headache disorders, and I advise you go back and watch that video if you want to explore that deeper. But I wish it was a simple problem. So you have to be patient, because what we're trying to do is not to give a quick fix like a painkiller to make your head numb so you don't feel the headache, but it's to fix the underlying disease. In the same way that a diabetic would come into a clinic very sick, and rather than just giving them pain pills so they don't feel their neuropathy and their low blood sugar and their kidney failure and their heart failure, they want to treat the underlying disease so these people get better and have a healthy life. And we try to do the same thing. So just like when diabetes treatment, they don't go, a person who's with a very serious diabetic disorder doesn't go to their doctor and expect to be fixed on the first visit. Now, often it takes 2 or 3 visits, sometimes more, but a very big reason why a lot of people don't get better is they simply give up way too soon. Now I know, and it's not just myself, but every major headache clinic in the country, we look like fools to patients sometimes because we have to try this, and if it doesn't work, then you try this, and then you try that. We also want to be safe, so we start with medications at a very low level and try to titrate up to avoid side effects. But that can take time, and then you might get to a maximum dose and it doesn't work. Now someday, and I hope it's in my lifetime, there's going to be blood tests to look at genetics of migraine and headache disorders, and from those genetic profiles we can come up with effective treatments from the very get-go. But until then, we have to do this process of trial and error. Now, patients, if they stay in there and work with us, there's a very good chance they can get much better. Now, the second reason that headache patients don't get better, and again, I said in the very first tape, I'm a very candid person. I don't have any political agenda. I love helping patients get better, but I'm not here trying to make money or or get fame or anything like that, just trying to help people get better. So I have no reason not to be honest about things. But I see a lot of patients who have never seen a headache specialist. And I want to go through that for a moment. They expect for every 30,000 headache sufferers, there's one headache specialist. And unfortunately, there should be no more than 3,000 patients for headache specialists. Now, headache patients first are seen by their primary care providers. They can help a lot of them. I have the deepest respect for primary care providers because they have to know a huge amount of things about a very wide spectrum of diseases, from heart disease to injuries to headache to all these different things. But they cannot know the depth of headache treatment that's necessary to help many patients get better, and that's not their fault. They're very smart people. But another very misunderstanding is that neurologists are headache specialists, and that is just absolutely not true. Neurologists who are headache specialists would be the first to tell you that the general neurologist doesn't have a whole lot more to offer a headache patient than a primary care level. So insurance companies and small communities often figure out or designate the local neurologist as their headache specialist. So patients go there and they don't get better and they think they've tried everything. And then there's also people in other disciplines who've never been trained in headache who claim that they have the magic cure, and you go there and you don't get better and you think, oh, well, I've tried everything. But a headache specialist is someone who's been trained in headache specifically, usually for years, to have the experience and the knowledge of helping people get better. Now, I'm unique that I'm a PA and not a physician. They don't teach headache medicine in PA school. We have one lecture or two lectures, and I know because I used to give that lecture when I worked at Mayo Clinic. But medical school training physicians really isn't much better. And what surprises, or would surprise most people, that neurology training, unless the neurology residency program is connected with a major headache clinic, the neurology residents don't get a lot more training in headache than even the primary care physician. Now, there's certainly exceptions. There are neurology residents who have a great interest in headache, and like I worked at Mayo Clinic, and they would come down and spend several weeks with us in training. And then now they're trying to fix this problem. They're creating headache fellowships, a one-year fellowship for neurology residents or after residency to get further training in headache. But that's going to be decades before they train enough headache specialists to treat all the patients. In the meantime, there's people like myself, like Dr. Moore and I work with, who got training from being around really smart people who've spent years in headache. We go to the scientific meetings every year, usually for a week. Read every journal that comes out, because I have a passion for helping patients get better. And to help them get better, I need to learn and as much as I possibly can about what's going on in the world of headache research. Now, the next item I want to talk about is why patients don't get better, unfortunately, is due to the problems of dollars, or financial problems. Financial restraints is how I would define it. Now, financial restraints come on several levels. The first obvious level are the uninsured. There's about 4.5 million Americans who have no health insurance whatsoever. Of that 4.5 million Americans, not 4.5 million, 40 million. Of that 40 million, somewhere around 4 million are headache sufferers. So if they have no insurance, they usually get very poor care. And some of them try to go for appointments, but they can't go regularly because it's expensive. And the medications they're used are very expensive. And the non-medication treatments are expensive. So that's the number one level. Now the next level, or what I would call the underinsured, or not just the underinsured. Some of these people have good insurances, but the real, getting into a philosophical problem here, headache as a medical disorder has never been respected very well. And it's sad. To be funny, I don't want to be funny, but to make a joke about it, if you had to pick a disease, I would not pick headache as a disease to suffer from, because you have a tremendous amount of discrimination due to one simple reason, and that you can't see headaches. Headaches are invisible. There's no MRI that shows headaches. There's no CAT scan. There's no X-ray. There's no blood test that shows headaches. And anyone that says they can pick up headache on a blood test is not telling you the truth. You can't even look at someone and tell if they're in pain or not. That's totally impossible. So for centuries, headache has been not respected. It's been considered a mental illness, which it is absolutely not. So people with even good insurances often are not covered in the way they should be covered for headache disorders. Now, when we opened up our clinic, I would say the #1 insurer in our region, an HMO, refused to let their patients come here because they said that headache was not a significant problem that needed referral service. And this is despite the fact I've been seeing their patients for almost 10 years. But nonetheless, patients who even have good insurance are discriminated against because, like in that case, they can't even come and see us. That one particular insurance company forces them to see people who are not treating headache. But then the other thing is headache medications. There's some basic medications that approved for headache that the insurance companies will pay for, but when a patient gets beyond that, it becomes very complicated trying to get medications covered for them. Even if they failed 10 things and the next thing works perfectly, the insurance company will not cover it because they don't see headaches as a legitimate disorder. Now, that's not to mention the non-drug ways of treating headaches, such as acupuncture, massage, things like that, which can be very helpful, but are just not covered by insurance companies. And that's unfortunate. Now, I'm going to move on to another level of financial restraint. It has to do with us who run headache clinics. Believe it or not, headache clinics have to struggle to survive financially, and most lose money. And this comes back to poor health care or poor care for headache patients because most of the major medical institutions do not want headache clinics simply because they don't make money. They don't do procedures. They spend a lot of time sitting and talking with the patient, and that's what you have to do to help people get better. But insurance companies don't pay very well for that. We charge a lot for it, and it looks ridiculous what we have to charge, but what insurance companies pay us is a very small percentage of what we have to charge. So that's another discrimination that makes headache problems or headache patients difficult to find good treatment. And the reason is, say for example in the Seattle area, there's 4 major headache clinics. 2 have closed this year and they probably won't be replaced because, again, there's not a financial interest. And there's pressure on us not to stay in business for the same thing. And I'm going to mention one last area of financial restraint that hurts headache patients, and that's in the area of research. I was the director of research at the Michigan Head Pain and Neurological Institute for a couple of years, so I've been very involved with research. Plus, like I said, I've gone to all the scientific meetings, both American Headache Society and International Headache Society. And there's 2 levels of research. There's the funded research, and most of that has to do with medications. And it's usually what I consider trivial things. Trying to prove that drug A is 5% better than drug B. They'll spend millions and millions of dollars to do that because there's a financial interest to sell the drug. But the hardcore research of really trying to get to the root of headaches and trying to find ways to treat them more effectively, there's very little money there. I hope that changes. There's more money coming into brain research. I hope it, due to this factor I mentioned earlier about discrimination against headache patients, I hope that it doesn't become a big factor and where that money is all steered in the direction of bad diseases like MS and dementia, but headache is totally ignored. So one last item, and that'll take us to number 6 of why patients don't get better, and it's what I call the delusion of the cause. I wish I could count the thousands of times I've had patients tell me that they're disappointed that I never looked for the cause of their headache. And this is after I spend an exhaustive amount of time explaining to them on the first visit what the cause of headaches are and how to treat them. Now, the causes are complex. We know we have it mapped out pretty well, not completely. It's a brain disorder. We know this factually. It's not speculation. But they're used to hearing a very simple cause. You know, you have a vitamin deficiency. You have toxins in your colon. You have black mold in your house. You need glasses, you have long hair, blah, 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 and it goes on and on and on and on. This list of causes of headache. And if I feel like my head is going to explode if I ever hear another statement that I haven't tried to find the cause of someone's headaches. We know the cause. If they're talking about brain tumors, if there's a suspicion, we will do a head scan to rule that out. But 99.99% of the time, head scans are normal and headache suffers. And that goes back to that philosophical problem of headaches not getting respect. But a lot of patients, and I wish I could give you a percentage, but it's pretty high. I wouldn't be surprised if it's not 20 or 30% of patients get caught up in simply trying to find the cause of their headaches and never move on to really trying to get good care. And it's not that we don't care about the cause. We care deeply about the cause, and we're trying to correct the underlying brain physiology. But it's not a quick little fix of moving a bone around or straightening a muscle out or something like that, and all of a sudden headaches are going to magically go away. And it's not going to be some secret thyroid problem or adrenal problem or pituitary problem that no blood tests can detect, or invisible Lyme disease or something like that. And I have many patients who I just want to help so badly, and they don't let me help them. They tie my hands because they're only interested in finding this magic cause, something that they've seen on a TV show like House. But House is an actor. Even Dr. Oz is an actor. They're not up to date on what's going on in headache treatment world. But we do know the cause. We will look for the bad causes. Most headaches are what we call primary type headaches, meaning the headache disorder, the alarm system in the brain, is genetically flawed, and that's why they have headaches. And the treatments that we offer, the preventative approaches, are the best way to get the headaches under control. I want to thank you for your time. I'm going to come back for one more lecture on the last 4 reasons of why people don't get better, and I'll see you then. Good night.